Progressive aligners are particularly good at correcting rotations, which is an important part of fixing patients' teeth. They want their teeth to look straight, especially that upper lateral incisor that just doesn't want to quite correct all the way and stay fixed. The reason why it works well is a combination of two things. The material is very good. It just has the right properties for correcting the rotations. And the other thing is that the technicians, the stagers, know how to move the teeth appropriately so that the tooth actually gets rotated. They move it slow enough, they use enough aligner stages, and also they avoid colliding with a neighboring tooth. Sometimes when I look at setups from other companies, they try to fix a rotation and I can tell it's colliding with the neighboring tooth, and that'll stop the correction from happening. So with progressive aligners, the way that the stagers move teeth, they move them appropriately for when I do braces, I know how the teeth are moving inside those braces to get things to go straight. And I see that same thing applied to the way that the stagers are moving the teeth in the setup for progressive aligners. And so I think a combination of how the stager does it and the material really gives us an excellent result in getting corrections. Plus, if I ask for an overcorrection, they don't just do that really fast at the end of the case. They'll just continually move the tooth until it's overcorrected so that I can get the full correction that I want. It works really well.
Rotations, yeah. Yeah, progressive aligners is very good at rotations. And of course, that's one of my hot spots. That's one of the areas that I have spent a lot of time working on because of the IP appliance. I have rotation brackets. Only appliance still that has that feature. And I want to see fully straight teeth. Patients want to see fully straight teeth. And so the harder you look, with the bigger the magnifying glass, you're going to see whether or not they've really got straight teeth. So we promise them straight teeth, give them straight teeth. Okay, so that's a _1 priority in a lot of cases. Why is it so effective with this aligner system versus some of the others, especially the leading one or some of the other ones? Well, I have studied this, and I think it has to do with the coordinated tooth movement, all teeth moving at the same time. So even if there is a collision of one tooth to another, there's not a space to allow the rotation. The other tooth is moving and making space. And so the little small movements eventually translate into a slow arch enlargement, that's what we usually do, expand, advance, and IPR, and to make these teeth align. So I've seen personally in my studies teeth without attachments that with other companies you go, no, that's not going to rotate. Even with an attachment, it's not going to rotate. Fix. Now what is that? That is coordinated tooth movement. That's quality of materials. I'm not saying never use an attachment, but I'm telling you, even under the worst situations, it's very effective. And if I want an appliance, a set of aligners, that's going to do one thing, correcting rotation would be at the top of the list because that's what the patients want to see. They want to see straight teeth, so let's give it to them. Bring it on.